the effects of that climate change has on public health. At last, the world is starting to realise that the climate crisis is becoming much more of a looming threat to society, caused by increased emissions and levels of CO2 and other greenhouse gases into the atmosphere. The change to the Earth's climate and system leads to profound effects on both society and nature, and highlights the interdependence we play on each other. This can be seen through the effects of climate change on public health, which the WHO claims climate will be the biggest threat. Climate change alters the equilibrium of the hydrocycle, resulting in more extreme weather events with greater number of floods and droughts and forest fires, which significantly affect the fundamentals of our existence through that of water and food by crippling our agricultural practices and causing water deficit, leading to many physical health risks such as malnutrition in areas affected by this. Furthermore, due to greater level of CO2 in the atmosphere, temperature is on the rise, which will further amplify the causes previously mentioned and will provide optimal conditions over a more global scale for vector-borne diseases to thrive carried by mosquitoes, causing diseases like malaria, dengue fever and Ebola. Due to pollutants being emitted into the atmosphere, it has led to unhealthy air quality in particularly cities, causing many respiratory issues such as asthma. The effects that climate change can essentially lead more people to being impacted and have their public health affected. As climate change worsens, this will keep happening more severely and frequently. The level of the extent of the impact that climate change can play on individuals is determined by a range of factors. It is cruel that people already living in low-income, disadvantaged nations are disproportionately affected when compared to high-income developed nations, as they have poor access or no access to healthcare, insufficient infrastructure and education to help understand and deal with the effects that climate change plays on their health. Demographic variation of people also means certain population groups are more vulnerable, including pregnant women and older people, people with cardiovascular, respiratory issues, athletes and outdoor workers. The morphology of the land can also hinder or exacerbate the extent of the impact. In low-lying coastal regions, islands, you're more likely to experience the impacts of climate change. Through the rising sea levels and storm surges and floods, the possible health risks of this are contaminated food and water, an abundance of viruses and bacteria in the water, potential limited access to healthcare. In high altitudes, you are less likely to be impacted by vector-borne diseases, as mosquitoes don't like the colder temperatures. However, climate change is causing a rise in temperatures globally and is providing sufficient conditions for mosquitoes to thrive at higher altitudes, affecting the scale which vector-borne diseases can occur. The physical effects to health, such as the death toll from the events, are the ones that are most visible, and what we used to put the primary thought into. However, this is changing. As a society, we are realising the importance, the mental health risk associated with the impacts caused by climate change, and this can also have a significant toll on our well-being. If we take COVID as an example, the deprivation of access to outdoor space led to 20% increase in mental health conditions between 2019 and 2021 of UK young adults, which demonstrates the potential impact of physical conditions that people have on their mental well-being, and this is a looming impact of climate change. The WHO claims the burden of disease associated with climate change will become more of a mental health concern than an issue related to physical impact on human health caused by climate change. The extreme weather events of flooding, forest fires, temperature and other impacts can create mental stress after these events through displacement of communities and loss of life. Also, the impact can happen before the event through stress, anxiety caused by anticipating what might happen. This can only get worse if we don't address climate change and the issues it causes. Although there are challenges for what the future holds, there are potential solutions to this. Fundamentally, this is no longer an environmental climate issue, but it is an issue for public health, both mental and physical. This is a potential platform upon which climate change can be more recognised and addressed. Governments have a key role to set frameworks to address climate change, and this can be through legislation such as the DEFRA 25-year plan, which sets out 10 goals for air quality, soil and carbon, the environment, to maintain and enhance the UK combating the climate crisis, and in turn its effect on public health. The national government are also key in making sure the major infrastructures exist within countries to deal with the impacts of climate change on public health by having good access to healthcare and sanitation and prevention methods to limit impacts of hazards such as flooding, by providing warning systems, and also provide sufficient education to the public health risks and how to cope to mitigate its effect, such as people with asthmatic conditions being aware of air quality levels and managing their own health risks. And that is the other solution that we need to be responsible for as individuals in managing the health risk effect of climate change, so we can act more responsibly in our behaviour to limit our carbon footprint, be aware of impacts of climate change and public health in particular locations, and actively self-manage personal health.